The young girls, you can do an ultrasound. The older ladies, you do a mammogram. And because of the difference between the scan and the mammogram, when you're younger, your breast has less fibrous tissue, so the ultrasound can pick it up. But when you're older, you have more fibrous tissue, so you need a mammogram. When you're older, you're stronger. You can take it to pain, right?
Yes, sir. Amen.
But I don't know, some of our grandmothers, how they have 14, 15 babies. That means they love pain. So when you talk about the little mammogram, every time you think about it, remember what your grandmother did through. 14 baby and push them out. That's a strong woman. Next. Almost true. Ovarian cancer. It's a cancer that older folks get. It's hardly in younger folks. And the thing about it, it's non-specific. But the symptoms are, if you feel bloatedness in your tummy, your mother has a history of ovarian cancer. And your ovaries, remember what the ovaries are? That thing that is the muscle out there. So if they start to have bloating, you start to bleed outside of your cycle, start to vomit, you start to lose weight, it's not normal. You want to go and get it checked out. The difficulty with ovarian cancer is that you can't really have a screening test for it. They might do an ultrasound scan, but that may not be picked up. There's a test called CA125. CA125 that is done, it will give you an indication if you have ovarian cancer. But everybody don't get up and do the test. It's only done when it's needed. So the older folks may get ovarian cancer. The younger one may get it. Alright? Next slide. I spoke about womb cancer. Let me ask. Any man in the... Hey brother, how you doing? Can you stand for me 1 second? Just a quick question. What two organs are those? Two organs that you put in that case. That? You sound like a strange dude. Say it over here again.
You have the vagina, you have the uterus.
This man is an experienced man. Sit down. You have the vagina and you have the uterus. So this man knows what he's talking about. He knows what it looks like. So you're not going to see, and get a bit. Stop moving. You're not going to see a name on the bull and You're not going to see the vagina or the uterus on the bull and You know what it is, okay? You see how the married man inside go away like, my brother, you kill me. Nah, kill me. I'm telling you what to do. No. Just like one of the problems we have in the church is that we don't talk or believe. And the main one is that they learn about these things outside of the church. And sometimes when it's taught outside the church, it causes problems. But when you teach it in the church, it's taught in a context. In the context of marriage and in the context that youngsters need to know about these things. So when the time comes, you can be empowered and you can empower somebody, alright? So that little swelling here is called endometrial uterine cancer. You see the thing that highlighted is endometrial cancer? So sometimes the masses in it, you just start bleed. Bleed. Papa them home, Papa can't get a chance. You understand me? Papa them on lockdown, COVID-19 lockdown. I come in them on lockdown, no blessing. You understand me? But what Papa needs to do, encourage you to go and check a gynecologist to see what's happening there. Next, I'm almost through, I promise you. And this is one of the things that affect in the spider mode. And I'm going to say anything because this is some young ladies here look a little bit older still. But I know all of you are young, but you'll reach this point in your life, it's called menopause. These women can be irritable, cussy, depressed, they become terrorists, no peace of yard. Everybody else cool, and they're hot. They're just hot. And then when you tell them, when they say they're hot, them start just looking at some people's Rodean, you're like, you know how much you want? Or they just hot. Because a part of menopause is that the estrogen level gets less, and the body is on fire. Let go. Missionary, the lady in the red hat. See that? She know me at that about. She's just smiling. No. So what tends to happen when you reach a point in your life? But there are certain things that you can use to help to mitigate or to against menopause. Yeah? Tell you? Let me be myself. Go to the next slide. Go to the next slide. Never tell you, see this stuff there here. For those who are not married, get a man. And one of the best man to get is Jesus. Because when you feel hot, Jesus can calm you down. Some of us, you know, I'm trying to get calm down to the end of the power. Even before you come to service, even the flesh is by your mind. When you rock in the spirit, I want you on this side. When you rock in the spirit, you say get calm. Cheyenne. Where's brother Cheyenne wife? I need to get her number because I just speak to her. 1 month probation. 1 month for you. So yes. This one. Next one. Yes. So these are some of the home remedies. So if you look at the slide, you can get some AC at the yard, get some fan, and calm, warm and cool you down. Then there's a vitamin E, apple cider vinegar. Nobody know flaxseed? Yes. Flaxseed. You can do deep breathing exercise, try to relax the mind. They said red clover tea. Nobody know ginseng? Yes. Ginseng. Then there's the black molasses. And there's one that is out that everybody drinking for everything. Everybody again. Dandelion. No man, there's a bush that you can get in your backyard. Mary, what's that? Stand Serrani. Stand Serrani. No more really gonna keep your calm until Brother Riley comes. Only Brother Riley gonna keep you calm. So I come from honestly, brethren, there are persons who have tried the miracle in the world. So there may not be studies that have been done. But anecdotal means persons who can testify that it happened. Even though the scientists have not done the test, but the meringue works and some of these works. So what don't work for you, may work for that person. So if you're going through that phase in your life, you can try the meringue, you can try the ginseng and see what works for you. And there are some persons who will get early menopause. So if your mother had menopause at 38, chances are you may have it at 38. If you had a surgery, you may have it. And guess what? If you want a child, and you heard that your mother had menopause at 38, let the Lord give you to say you can get married from early and try to have your child from early. Amen. And if you reach 38 and look for a husband, only a miracle will give you that child. And it doesn't know if your mother has menopause at 38, you will have it, but there's a chance that you can have it. Alright? So menopause is real, it is happening, and it's not that these old ladies are hot, their body's just hot. Yes, right. Alright. So, you see I did justice. I had an interview 2 days ago. Sister Thomas had for 3 hours. 3 hours. You know how much for 3 hours in my private practice? That's over $1 million. But my aim was to empower the body so that they understand. So brethren, all women have a discharge. The discharge can be normal or abnormal. If it is not clear, watery, it's abnormal. If it starts to get yellow, green, abnormal. All women should bleed. You should be bleeding for 3 to 5 days. It should not be more than 2 to 3 pads per day. If you're using up to 10 pads per day, something is wrong, you need to be checked out. Bleeding in a menopausal woman is not normal. You may have fibroids and you don't bleed. If you have fibroids and you bleed, you may need to get a surgery or you may need to take some contraceptive pill. And those persons in the menopause group, the fibroid will shrink. Okay? Cancer is real. Cervical cancer is real. It can be prevented with a pap smear. Ovarian cancer is real. It can be prevented if you know your family history and if you have any symptoms, you check it out. Breast cancer is real. Do your breast check. Once you pass 30, try it on ultrasound of the breast. You pass 40, try it on mammogram. Okay? Amen. Womb cancer is real. If you're over 50 menopause and you're bleeding, you're not in any position to get pregnant again. So don't tell your husband to fix you up. The doctor needs to fix you up. Alright? Amen. And finally, your health is your wealth. And if you don't take good care of your health, no amount of shaking in the spirit, shanda, and all those stuff. You want to be in good health. God didn't create doctors to just, I don't know if I look nice, but just look nice in a stethoscope. But He created us for a purpose. Go to somebody who you're comfortable with. If you desire to come to Dr. Wallace and I come to church, I won't look at you. I will just, I won't even look down there, alright? Men, that your wife is alive? No. That your wife is alive? No. Wife is alive?
No, it's not alive.
Man, I feel a move. When you go home, or later though, examine. So come, I say, I am a gynecologist. The doctor said, that is that. Let me see if you have that. Let me see if that is normal. And that's how you're supposed to be. Examine your wife. And vice versa. And the final thing I'll talk about, men. The leading cause of death in men, apart from violence and gun and shooting, is prostate cancer. If your dad had prostate cancer, your uncle had prostate cancer, 10 years less than that. If they had it at 40, start your screening at 30. 2 ways to screen. Most men are afraid of it, including myself. I don't want nobody to put their fingers around here. The blood of Jesus. However, there's a blood test that can be done that can tell you the PSA to see if it's increased. If that blood test is increased, elder, you have to put the finger around here. And when you come to church, no longer virgin. So get checked out. Keep healthy, stay healthy. God bless you. 2 minutes for questions. Or 5. Go ahead, mommy. Alright. Good. Prolapse is one of those conditions that is common in older women. It is common in women who have several cases. Now, one of the things to prevent against it, some persons do conservative management, which is, there's some Kegel exercise that you can do. So maybe you may have to go online and go on YouTube and get somebody to help you to see the exercise that strengthens the muscles down here. Then 2, the gynecologist can get a ring, a little ring, and put it around the organ that is collapsed. But the vagina can collapse, the uterus can collapse, the colon can collapse, and the bladder. So the gynecologist can get a little organ, a little circle to put there. And the next thing you have to do, avoid heavy lifting. Avoid having cough, because all these things increase the pressure. And when the pressure inside is increased, the prolapse takes place. And finally, with all the conservative measures, like the stop lifting heavy things, the ring, and even estrogen cream fail, you can have what you call a hysterectomy. Most persons are afraid of surgery. You can have a hysterectomy that helps. But the main thing, conservative, get some estrogen cream put down there, stop doing heavy lifting, stop behaving like these young 16, taking up all these heavy stuff, control the cough, and do the exercises, and that can help. Any other questions? Listen, you may not get this again, so ask the question. So a regular cycle should be between 28 days to 35 days. So the first time you bleed, So the next time you bleed, that's supposed to be 28 to 38 days, 35 days. If it is less than, way less than 28, or greater than 35 days, that's irregular. If you bleed more than 80 mils of blood, meaning if you're using more than 6 pads per day, within 3 to 5 days, that's irregular. If you're having severe pain with clots, and I mean you just get weak and feel mashed up, it's not normal. So those are things that, and the most likely cause is what's the most likely cause? Nobody can tell me the most likely cause? Sure. Anybody, if you tell me the most likely cause, I'll get a phone call from Rodean. No, maybe hospital. Come on, tell me the most likely cause. Stress is one of the likely cause, but the most likely cause. Anybody? Next one.
Cancer.
No, come again. Anybody have a belt? Come on, beat everybody. Go back to that slide, Papa. Go back to. Just how do you go back straight to bleeding? Go back to bleeding. Go back. Stop there. So you see the normal cycle versus the abnormal. And I come down and I say abnormal bleeding. After abnormal bleeding is what? Hormonal imbalance. Okay, I didn't hear you. So, Brother J, or your $100 card? Yeah, man, that's it's hormonal imbalance. What can make the hormonal imbalance? Stress. A little bit of extra weight. PCOS. All the causes that you said can contribute to hormonal imbalance. That can cause abnormal bleeding outside the cycle. Any other question? 2 more questions.
Doctor.
Yes, patient.
Can ovarian cyst bleed?
Yes. There are some ovarian cysts that are small. Hemorrhagic cysts. They mean that they have blood inside. So sometimes you might have bleeding from that cyst, especially if you rupture. The important thing though, you can mix up that cyst with cancer in an organ. So if they say they have a cyst and you're bleeding, make sure they do a scan or CT scan or ultrasound check that is an ovary that was bleeding and not the lining of the uterus. So don't let them tell us, no man, you have a hemorrhagic cyst that bled. No. If you're in a particular age group, mostly above 45, you have a cyst and you're bleeding, make them work here until they get hurting. Alright? Don't just settle for the fact that they say, oh, it's a cyst that bled. No. I've seen a lot of GPs, and I warn my brethren, I may not be in this area for you to come to me, but I'm not saying you must go to GPs. But when you have a real woman issue, try to get a gynecologist. Because the GP will play around with you to get some money from you. Come back next week. When you come next week, they say, I don't want to scan you. You come back next week. When you're done, you have spent $50,000 on the GP. If you had gone to the gynecologist, you have spent $5,000. And they would have told you what was happening to you. So the GP has to go around the mountains. The gynecologist says, this is what is happening. So sometimes just
Say what GP?
general practitioner. Sometimes just make a sacrifice by the gynecologist to assess you and you get a proper diagnosis and you're treated. That's right. What? Then, when the men's president invite me, I make a sacrifice to come and, trouble the men among us and the men from the community. And it will be a pleasure. And one of the things about the best person to address men is the gynecologist. The gynecologist knows everything about the woman that you need to know. You understand me? So the gynecologist is the one who asks the question, so doc, when my wife did this, what I should do? When my wife slapped me in my head, what I should do? Stop touching what you must touch. So when the men's president invite me, I'll oblige.
Can prolapse get better?
1 second.
Can prolapse when the condition
Let me hear what mommy said.
can that condition get better?
What?
Prolapse.
Yeah, man, the prolapse can get better. So if you get that, prolapse is where in the vagina, the uterus, I'm talking now. So in the vagina, the uterus can come down, the bladder can come down, the bowel can come down, or the colon can come down. The reason why it comes down, the muscles in the pelvic cavity down there become weak. Weak because of pregnancy, you have 6 kids, 7 kids, weak because of surgery, weak because of obesity, weak because of several things. So you can correct these things by exercise, losing weight, stop eating heavy stuff, and so forth.
Alright, hold on, Sister White. So we're going to have Sister White as two persons. Oh. Alright. Sister White, Sister Van Shanway, I think they asked the question already. So we'll take Sister White, Sister Lucia, and Sister Blackwood? Sister Blackwood.
Because I'm going to take a question.
You never asked him?
I'm going to take a question.
Okay.
So go ahead.
Suppose you have a cycle that is less than 28 days.
So a cycle that is less than 28 days, it can be deemed irregular. But nonetheless, that cycle, especially in a situation where you're trying to get pregnant and you can't, that's a cycle that you have to study. And I just simply say it. The last 14 days in your cycle is constant. So every woman inside the last 14 days is constant. So if you have a 21-day cycle, take away 14 from 21, you how much? 7, right? So on day number 7, that's when ovulation takes place. So 2 days before, which is 5 days, 2 days after, 9 days, that is the most fertile part of the cycle. So what I'm trying to say, if your cycle is less than even 28 days, you can study your cycle and find out when you're very fertile by understanding that the last 14 days is constant. You count from the first day you have a bleed to the next first day of the next cycle. If you get 25, you take away 14 from 25, being how much? 11. Day number 11 is ovulation, meaning that you're full of egg, you're ripe, you're prosperous, you feel like a labor right? 2 days before and 2 days after, the best time to stop that marriage. So even if the cycle is less than the norm, you have to study it and understand it so you can know when to function. 3 more questions, then I'm done. Not hearing you so well.
After remove the mask and speak.
What age?
You can start, ideally, at 50, 51. But some person might go through menopause a little earlier. If you have a family history where your mother, your sister go through from turning on or 40 on, you can go through it at that time. But this is what menopause is. Only stop. You just don't have any period. What do you mean when the symptoms stop? The symptoms is expected to last about 10 years. Yes, so you can stop. Your body can become adjusted to it and it stops. However, you may need to take some medication to stop it. Some estrogen cream, some antidepressant, and all the ginseng and the rengue to help you. Alright? What are the rest of the questions?
Yes.
Sister Thomas?
Vagina self-clean. You said that the vagina self-clean.
Correct.
Right. So is it okay to use your regular soap, bath soap to wash it or just wash it with pure water?
I mean, you can use pure water and you can use regular soap. Don't use no super scented soap. A super scented soap kill the normal flora, the normal organism. So don't use the carbolic and the
Protect.
blue soap and the don't put no fab in it. Don't put the Irish Spring. You can use the natural water, or if you feel a little bit nice, put a little, maybe a little drop, which has less scent. That will keep it. If you find that you're having anything outside of the normal, you start, you can see a GP. But if the GP treating you still having the discharge, so the kind of problems, alright?
Alright, quickly, Sister Shanavan and Sister Taylor. Go ahead, Sister Taylor.
Sir, over the past month, never before I was up tendency to break. And that scar, can't touch. It's like people don't touch.
Alright. That baby is yours?
That kind of the one.
That baby is yours?
Sir, I am 52.
No, let me tell you the reason why I asked. Because if you have a baby and you're still breastfeeding and you're having tenderness, it could be because of that. Then the next thing could be, if you're having tenderness in the breast, it could be like you're going to have fat tissue, it could be an infection, it could be cysts, and it could be that time of the month. Because
That
some,
time of the month.
yes.
Never been happening. Only this year I realized that.
And it could be changes in your body. That time when the month is supposed to come, hormonal changes, you start feeling tenderness. And that is the time your husband around. Somebody call the elders to lay hand on the breast at your husband, alright? So he can massage, he can bless it, and he can put it back in good standing.
Sister Shanavan.
My last question, Sister Shanavan.
Alright, how does one identify when they're having a hormone imbalance? And what are the natural or home remedies that you can actually use to
Alright, so when do you realize you have that hormonal imbalance? Several things can happen. The same breast tenderness can happen. You can have bleeding outside, you can have acne, the face start looking, little bumps all over. You find that you're having more discharge than normal down there. You may even have yeast infection, itching and all this stuff. Because a lot of persons who, and those persons who have extra fat on the body, hormonal imbalance. Those persons who over-exercise, the slim girls, those persons have hormonal imbalance. So the history will tell us, and the changes in your body. What can you do naturally? So you can eat right, less fatty stuff, less of these white powder that push up hormone in your body, and that can, so you eat right, exercise, lose some of the fat tissues, it produces estrogen, and that estrogen causes a lot of stuff in your body. It can even lock down your cycle. Chicken. So sometimes instead of, I normally make this joke, Brother Shire, to stop being boring, chicken can be looked after in several ways. Stew, fry, curry. Stop just fried chicken. A word to the wise is sufficient. So I never tell you how bad I mean. You know, tell him to there are other ways, alright? Not just the frying. Nah, judge it, alright? So what I'm saying, changing your diet can enhance. Changing the diet can enhance a good body size and help with the hormone balance. And even the same gym thing and those stuff can help at times. And my last question, who's going to ask the last question? So,
Alright, praise Jesus.
no, sorry. Give your praise Jesus. Any other men have a question?
I have your question.
Brother,
You need to learn.
Okay. Any other brothers, don't you have any question? Don't worry, your session soon come. So when your session come, we got a lot of some sisters.
Amen.
Thank you very much for having me.
Our praise